doing today?
Good, how are you today? I'm Bob.
I'm going to be treating you from the base of your head down to your belt line. If I need to expose any skin, is that going to be alright with you today?
Yes, sir.
Are you currently cleared over in the clinic?
Yes.
And are there any contraindications that I need to be aware of?
No, sir.
Alright. Can I get you to come over here and take your shirt off? And can I get you to sit facing that way?
Yes.
With your hands facing up. Alright.
Come on.
Bring your arms back here. Alright, can I get you to cross your arms for me?
You're good, you can take sound out.
Go.
Alright, can I get you to lay face down on the table for me?
Sure.
During my initial general scan, I found a restriction in the mid-thoracic region. With my fingers, the inner spinous spaces of the restricted segment, I assessed flexion and extension. There was no separation between the T6 and T7 spinous processes. During flexion, so I then assessed right and left rotation and lateral bending using my thumb at the lateral aspect of the spinous processes. To assess infield, I used the lateral to medial and posterior to anterior vector. I found a left rotational restriction, so I then assessed the rib by counting 2 interspinous spaces up and right 2 inches. To assess elevation, my starting contact point was at the inferior angle of the rib, feeling for separation between the lower rib. Infield was assessed by pushing inferior to superior. To assess depression, I moved my thumb to the superior border of the rib and pushed superior to inferior for infield. I determined that there was no restriction in the rib, both had good inplay. To identify the restricted segment, I used the spine of the scapula, bisected to the midline, and moved up one spinous process, 2 interspinous spaces up and right 2 inches. To assess elevation, my starting contact point was at the inferior angle of the rib, feeling for separation between the lower rib. Infield was assessed by pushing inferior to superior. To assess depression, I moved my thumb to the superior border of the rib and pushed superior to inferior for infield. I determined that there was no restriction in the rib, both had good inplay. To identify the restricted segment, I used the spine of the scapula, bisected to the midline, and moved up one spinous process, and found the restriction to be at the T6 level. Next, I noticed several other areas that needed further evaluation. The right SI joint had some restriction. On my initial scan, I used the PSIS as my starting contact point, and my line of drive was at 45 degrees posterior to anterior and felt no joint play on the right side. Upon further evaluation, my starting contact point was between the ilium and the sacrum. I was feeling for separation. I determined he had a posterior glide restriction and an internal rotation restriction due to no separation of movement between the ilium and sacrum in the respective planes of motion. The third restriction I noticed was in the mid-cervical region. With my fingers between the interspinous spaces, I assessed flexion and extension, moving my thumb to the lateral aspect of the spinous process. I assessed joint play for left and right rotation and lateral flexion. To assess infield, I pushed lateral to medial and posterior to anterior. I found a left rotational restriction due to the fact that there was little joint play or infield when the head was in left lateral bending. In order to find the segment that was restricted, I found the vertebral prominence and counted up 2 spinous processes to come to the conclusion that the restricted segment was C5.